You walk into a quiet room, paints and paper are set out. In the corner, a drum. Someone is moving slowly to music, eyes closed, a therapist at their side. This isn't a community art class, it's depression treatment. Today, we're exploring how creative arts therapies, art, music, dance, drama, even photography, are helping people live with and move through depression. Welcome to The Art of Healing, the show where we look at how creativity and care come together to support mental health. In this episode, we're asking a simple question: how can art, movement, music, drama, and images actually treat depression, not just distract from it? Indeed, around the world, depression is one of the leading causes of ill health and disability. And yet, researchers and clinicians argue that arts therapies are still underused, despite growing evidence that they can reduce symptoms and improve quality of life across the lifespan. Today, you'll hear how these therapies work in real clinical settings with children, adults, and older people. Let's start with the basics. When therapists talk about arts therapies and depression, they usually mean four main disciplines: art therapy, music therapy, dance movement therapy, and drama therapy, plus emerging approaches like phototherapy. These are not just doing art or putting on music. They are structured, evidence-informed psychotherapies led by trained therapists, where the creative process is a primary way of exploring feelings, relationships, and patterns linked to depression. For instance, art therapists might use drawing, painting, or collage to help people who struggle to put their depression into words. Music therapists might use improvisation or shared listening to shift mood, stimulate brain processing, and support emotional expression. Dance movement therapists work with posture, tension, and movement habits that often mirror low mood, helping individuals feel safer, more energetic, and more connected to their bodies. Drama therapists, on the other hand, use role play, storytelling, and playfulness to loosen the stuck roles of hopelessness and withdrawal. Across all these disciplines, the shared idea is that depression often manifests as a loss of energy, imagination, connection, and play. And engaging in creative work gives safe, structured ways to rebuild those capacities. So how does this look with children and young people? For primary-aged children, music and movement-based therapies have been used to prevent or reduce early depressive symptoms, especially when there's trauma or family stress. In fact, in a child and family psychiatric unit, therapists have employed rhythm, song, and shared musical play to help regulate feelings and strengthen attachments with caregivers. Meanwhile, art therapy has proven effective with children who've experienced stress or trauma, offering a way to draw the story when words become overwhelming or confusing. Over time, through repeated sessions, children can see their own images change, transforming from chaotic, fragmented scenes to more coherent and hopeful pictures, ultimately mirroring shifts in mood and self-understanding. Speaking of adolescence, drama therapy has focused on group role play and storytelling for those living with both post-traumatic stress and depression. By experimenting with different roles, such as victim, helper, witness, and survivor, young people can safely test new ways of seeing themselves and others, which can help reduce depressive symptoms and enhance a sense of agency. Moving on to adults, we find that depression often intertwines with shame, rigid self-criticism, and withdrawal from relationships. Drama therapists sometimes describe depression as an absence of play, or liken it to a tightly tangled ball of black yarn. Their work focuses on helping people rediscover that playful spirit and slowly untangle the yarn through embodied role work and improvisation. I recall a compelling story from a residential program for individuals struggling with eating disorders and co-occurring depression. One therapist shared about a young woman who rarely spoke, often dissociated, and unfortunately engaged in self-harm. In drama therapy, this client was invited into an improvised scene where imaginary horses circled around her, allowing her to play with her fears of animals and contamination, while held by the support group. Over time, she used this drama space to express her violent and self-destructive impulses symbolically, leading to reductions in actual self-harm and heightened motivation for recovery. Additionally, dance movement therapists focus on how depression physically manifests in the body: low energy, poor posture, limited movement, disturbed sleep, and a painful or fragmented experience of the body. Groups of about 12 participants in 90-minute sessions have reported improved body image, better stress regulation, a stronger sense of safety, and increased social engagement. Meanwhile, music therapists blend clinical practice with research on music and its effects in depression. For instance, improvisational music therapy helps clients access emotions, shift patterns of brain activation, and build a therapeutic alliance, which are critical for symptom change. Let's take a look at older adults, where depression often overlaps with loss, physical illness, dementia, and social isolation. Art therapy for elders centers on one life, many losses, creating a space to illuminate memories, relationships, and identities that may feel obscured by aging or illness. By creating and discussing images, older individuals are able to process grief, maintain continuity in their identities, and feel seen beyond just their diagnosis. Drama therapy, particularly with individuals living with dementia and depression, emphasizes playfulness and the concept of creative aging. Simple scenes, songs, and movement games can break through barriers of isolation, spark joy, and renew moments of personhood, even when verbal memory is significantly impaired. Dance movement therapy groups for older adults have shown improvements in mood, body awareness, and social interaction, illustrating that work with movement and relationships remains impactful well into later life. Moreover, music therapy specifically tailored to the personal musical histories of older individuals in geriatric psychiatry and nursing homes has shown promise in reducing depressive symptoms and enhancing engagement. Now, across all these age groups, research in arts therapies for depression comprises clinical trials, surveys, and detailed case studies. The consensus? Arts therapies can indeed mitigate depressive symptoms, bolster social functioning, and enhance overall well-being when applied by trained therapists within a coherent treatment plan. It's crucial to remember that these therapies do not replace medication or traditional talking therapies. Rather, they offer an additional route that can complement more conventional interventions. So as we wrap up this exploration today, it's essential to recognize that creativity holds immense power in the realm of mental health. Whether through visual arts, music, drama, or movement, these therapies offer innovative pathways to healing, and they inspire not just expression, but connection, hope, and recovery. As we leave you today, we hope you feel more curious and hopeful about integrating creative approaches into mental health practices for yourself or someone you care about. Remember, the art of healing is indeed a journey worth exploring.